I'm Dr. Lowell Tilzer, Medical Director of the Transfusion Service at the University of Kansas Hospital. Blood banking is what is known as transfusion service. There are two components. One is where they collect it, process it, test it, and the other is where we retest it and then prepare for transfusion of the various blood products. First are the blood collection centers. They collect it either at the blood center or on blood mobiles, where they send out teams of nurses and technologists to collect blood from donors. They bring it back to the blood center and they process it into various blood components: red cells, platelets, and plasma. Once all the testing is done and it's stored properly, the blood is moved to the various transfusion services or blood banks. We are one of them in Kansas City. Community Blood Center supplies about 70 hospitals with blood, and our transfusion service uses more than anybody else in the region. Every time you donate, whether you donate once or 100 times, your blood is tested with 15 different tests.
Put them in like this.
HIV, hepatitis B, hepatitis C. When we get it here, we retest it to make sure that the correct ABO/RH is there, and we retest your blood to make sure that we've got the exact right person that we're transfusing to. Most of the blood components that we transfuse are red blood cells. Red blood cells consist of about a half a pint of hemoglobin-containing red cells. Again, we have Group O, Group A, Group B, and Group AB. Once we decide which ones will be done, we issue it by pneumatic tube to the floor or to the cancer center, wherever it might be, and we allow them to transfuse. It takes anywhere from 2 to 4 hours to transfuse a red cell, and it increases the oxygen carrying capacity of the blood. The other component that we use is called platelets. These are responsible for the primary plug when we cut our cells. And platelets, this is a group B platelet, are very important for our leukemic and our cancer patients. The final component that we have is plasma. It's kept in the freezer, and plasma is important for people with coagulation defects, people who don't have enough clotting factors. Both at the blood center and at the transfusion service at University of Kansas Hospital, we do everything we can to make your transfusion, if you need it, as safe as possible. Thank you very much.